welcome to this episode of The Doctor Is In. I'm Cory Burnell and I'll be the host. And for those of you who've seen this show before, you're well acquainted with Dr. Randall Smart. For those who haven't, welcome to meeting Dr. Randall Smart for the first time. And Dr. Smart, good to see you again.
Thanks, Cory. Great to be here today.
Yeah, well, we always enjoy these shows with you, and it's always a wealth of information.
Right. Well, thank you.
Yeah, so I guess you told me our viewers are going to get to learn a little bit about snake bites today.
Rattlesnake
bites.
Right.
Okay.
So this is the time of year where the snakes come out. Almost all snake bites are late spring, early summer.
Okay.
And so if you're working in a hospital, this is the time of year we see the snake bites and we get the phone calls. And I thought, we should probably talk to the audience a little bit about what we know about this.
Well, it begs the question, why the seasonality? I would think snakes are out all summer long into the winter, and then I suppose they hibernate a bit during the winter time. So why the seasonality to it?
There are these people called herpetologists, and they could probably answer that question better than me.
Okay.
But my understanding is snakes are cold-blooded. So as it gets colder, they just go to sleep and don't wake up. Mm-hmm. And as it gets warmer, their blood warms up and they come back to life and they come out. And
now it's time to feed, huh?
Yeah, now it's time to get back to normal. And I think that's probably a big part of the whole thing.
Yeah, that would make sense.
Right.
Well, all right. We live in rattlesnake country, as all of our local viewers would be far, well aware of. Most of us have had a rattlesnake on our driveway or at our front door, on the porch. At some point, had a cat or a dog around.
Almost everybody has a rattlesnake story.
Right. Yeah.
And it's kind of the fish story.
Yeah.
This fish, right?
Yep.
Yeah. How big was the rattlesnake? And,
Yeah.
How did you catch it? And
well, if somebody, I guess, you see the bites come in. And so from a medical, I could ask you a lot of stuff about rattlesnakes, but like you say, you're a doctor treating the bites. So let's talk a little bit about what happens in the clinic when somebody comes in with a bite, and how your staff, your doctors and nurses go to work on them.
Oh, sure. So usually people self-identify, that I got bit by a snake, but not always. The little toddlers sometimes don't know they got bit by a snake. They just are sick, and the mother or father bring them in, and then there are some disabled that can't really articulate a snake bite. But you're right, 90% will self-identify and say I got bit by a snake. So some of the key things we need to know is what kind of snake was it, and you would not believe how confused people get about this. Mm-hmm. Did you see it? What kind was it? And what I would strongly recommend is you take a picture of the snake. Mm-hmm. Everybody has an iPhone, right? Everybody. So you've got this camera wherever you go, on the way to the, before you back out of the scene, take a picture, because we really need to identify, whether it's a gopher snake or a bull snake or, a rattlesnake. Mm-hmm. And usually they're pretty good at identifying it, but we need to know that. We also need to know what time they were bitten, and if they can give us a time. I was, it was 3:15. That can be very helpful.
That's so you know how long the venom has been in the system, if there's venom? Is that what we're after? Okay.
Yeah, correct. And we want to follow certain things over time. Mm. It's kind of a disease of time, or an intoxication, really, of time. So those things become really important. And then there are things you probably don't want to do. Like you don't want to, kill the snake or fuss around with the snake or get him. You want to go away.
Don't want to get bit a second time?
Right. So you don't want to do that. You remember in the old days how you would suck the venom out?
Yeah, I was going to ask you about treatments like that.
You would cut it open and suck it out.
Yeah.
And
no truth to it?
Not a good idea.
Oh, okay.
No, not a good idea. I guess it depends on how pretty she is, but in general, it's not a good idea. And then remember also the old days, the tourniquets.
Yeah, I would think that would be a good idea, no?
Bad idea.
Can you
really
explain
bad.
why? What's that?
Well,
do?
right. So, yeah. So most people don't have experience with tourniquets and don't understand how to use them. They tend to make them too tight.
Okay.
When they do that, the venom, if it's an envenomated bite, becomes kind of behind the dam, ready to go. So the area involved in the bite becomes worse, and then when the tourniquet is released, you get a bolus of venom throughout your body.
Okay.
Not a good thing.
So, are you saying that it's actually better to let that venom slowly spread over the whole mass of your body rather than concentrate it in that location and then release it all at once? Is that what's going on?
Well, a whole mass of your body is a little bit more than we're after.
Okay.
But yes, right.
Okay.
It's better. So most snake bites, this is interesting. Okay, fun facts, right?
Yeah.
So most snake bites are on the legs, on the lower extremities. The exception is men. Most men get snake bites on their hands.
We actually try to reach out and get the snake. I
I
would never do something.
I could give you stories. So most snake bites are on lower extremities, as you might expect. Either you step on a snake or there's one in the path, and you get the bite on the lower extremity. But men get them on their hands, pretty predictably. And so you can identify the fang marks where the bite actually occurred, and then it will gradually spread toward the shoulder.
Okay.
Yeah, so you're not massively letting it through the whole body, but you're going to watch that. If it is envenomated, you're going to watch that move kind of up the arm, if you will, and that's something we track pretty carefully.
Okay. Is there actually tissue being killed by the venom during that time from a rattlesnake? Is it?
Bingo.
Okay.
So in rattlesnake venom, rattlesnakes isn't a big interest of mine. I think the bites are very interesting medically, but I don't really care about the snakes.
Mm-hmm.
But I was amazed when I first started reading about this. Back when I was doing more hospital work, and there are a lot of different kinds of rattlesnakes. I mean, I thought there were like three, like the diamondback and ours, which is called the Northern Pacific rattlesnake, and maybe the sidewinder, and there's like 12. I mean, there's all kinds of different rattlesnakes. There's timber rattlesnakes, and there's I mean, there's all kinds.
Yeah.
So the one we deal with in Calaveras County is called the Northern Pacific rattlesnake. There's also a Southern Pacific rattlesnake. But of the pit vipers, which are copperheads, water moccasins, and rattlesnakes, rattlesnake bites are by far the most common and the most dangerous.
Oh.
Yeah. So the venom of the rattlesnake, I think this was your question, the venom of the rattlesnake has about 50 different things in it. It's not like one thing.
Oh.
It's a bunch of things. And these are proteins and enzymes and so what we believe is happening is that envenomation is designed to start the digestive process. So that snake, when it bites something and it puts in the venom, it's planning on eating it.
Mm-hmm.
Now, it's not going to eat you or me, but like it eats squirrels and rats and things like that. And so when you envenomate it, you probably speed up its death, but you also start the digestive process, so it can be food. And so those 50 things in the venom are start digesting your hand or your foot or your nose, wherever you were bitten. And so there's a bunch of different stuff in it.
Well, that makes me think about, okay, there's 50 different ingredients, you might say, chemicals in that poison. I would imagine that human beings, we probably, depending on our genetic makeup, respond differently to this. Maybe some people have more of an allergic reaction, or more, maybe their immune system goes into hyper overdrive on it, whereas other people maybe it doesn't. What do you experience in that regard, the variance amongst patients as to How?
Well, you're right, Corey. There is a big spectrum,
Okay.
and so there are what we call dry bites, and a dry bite is a non-envenomated bite.
Will a rattlesnake ever do that? Or will it always be a venomous bite?
25% of bites are dry bites.
Oh, really?
Yeah, so 1 in 4 is a dry bite. That's what you want.
Sure.
Well, you want no bite,
Yeah.
but then you want a dry bite. So the others, there can be different, really amounts of venom that can be injected into the bite, and so it can be a small amount of venom or it can be a larger amount of venom, and then you're right, your immune system and your blood in particular will react to that, and some people really react, and some people don't react as much. So you see a real variety of effects from those bites. But I'll tell you, one of the most challenging things, and this is one of the things I want to bring up today, is if I'm in the emergency room or the clinic or whatever and the snake bite comes in, one of the most challenging things is sorting out somebody's anxiety from an envenomated bite. And man, they can look really, really similar. And so people get anxious, they get nervous. I got a rattlesnake bite, I'm going to die.
Yeah, people
right?
think you're going to die from it.
Right.
Yeah.
And so that anxiety causes a faster heartbeat, causes you to breathe a little more, maybe causes a little bit of this. Well, a rattlesnake bite will do the same thing. If you are envenomated, it can cause you to be sweaty, it can cause you to be breathing a little bit harder, can cause some gastrointestinal symptoms, and anxiety and a snake bite can look very, very similar.
With that venom in your system, where does that venom have to get to actually kill the person? Does it get to the heart? Does it destroy vital organs where they end up dying from organ failure? Does it go to the brain? And then, in that regard, does the anxiety and your blood pressure pumping the blood through your system faster, does it get the venom to those spots in the body quicker that you don't want the venom to get to?
I think so.
So calm, cool, low
easy
heart
to
rate
say,
would be,
right?
yeah.
That's like saying your house is on fire, don't panic.
But relax.
Just relax, it's okay.
Right.
So very easy, but as a rule, if you know the more relaxed you're supposed to be, let's say it's a family member, what you're supposed to do is calm them down. The calmer you are, the better this goes. And so you need
Keep that heart rate down.
And so the more relaxed you are, and what we usually recommend as a first aid measure is to immobilize that arm or leg, and to put a pressure dressing on it.
Okay. What would a pressure dressing be? Like an ACE bandage?
No, more like just a little bit tighter bandage.
Okay.
Yeah, but it can be an ACE bandage, but probably not necessary. And so we immobilize the extremity, and we recommend some sort of pressure dressing, and then to make it to the hospital on the most expedient way you can. But the venom, first of all, we're kind of implying that lots of people die from these bites and they don't.
Yeah, is there a rate on that?
There is,
what's
yeah.
the rate
So in the country there are thousands of bites, 20, 30,000 bites a year. 4 or 5 people die from that.
Oh, wow.
Yeah.
Okay.
Yeah, so you're much more likely to die out on 49 than you are from a snake bite. They're just typically not fatal events.
Okay.
Although there are those 4 or 5 cases. I was dealing with a case, must be 10, 12 years ago up at the Mark Twain Hospital, and I was worried. I thought he was, and we actually shipped him down to UC Davis, and he did fine, but he had a really toxic reaction.
Are there higher risk demographics for snakebite deaths? I mean, if we're over a certain age, or if we're toddlers, I would think a smaller person would maybe have
Did you
higher
read the
risk.
book? So the infants and toddlers have more serious reactions.
Okay.
The older people have more serious reactions. And get this, I think this is really interesting. People who have eaten snake meat have more serious reactions.
You got to be kidding me.
See, I knew you
And we've
would
actually studied that, huh? Oh, that's
Somebody
something.
studied that. Well, I had a brother that ate snake meat. My brother Dave. We grew up in Avery, and we had snakes all the time. I mean, every year. And he killed about a 5.5-foot rattlesnake, and decided he was going to eat it. So he was old enough to make his own decisions,
Sure.
and most of us kind of watched. And so Dave skinned out the snake. It was white meat, and he cooked it and ate it.
Yeah.
But he only did it once.
Okay.
But it's interesting.
Yeah.
Those that have eaten snake meat have more toxic reactions.
That's fascinating.
Those that handle snakes have more toxic reactions. And those that have been bitten before have more toxic
Interesting.
reactions.
So there's no immunity benefit to, say, eating snake or getting bitten before your body
I
doesn't
don't
generate any
think
kind of
so.
antibodies to this.
I don't think so.
Okay.
Right.
Interesting.
So yeah, we see patients who are anxious and bitten, and the first thing we do is try to figure out what happened. What did it look like? How long ago was it? The things we mentioned earlier.
Mhm.
And then we usually you can identify the fang marks. Now, interesting. Sometimes there's only one fang mark. So everybody's always looking for two. And that's usually what you find. But it can be one.
Okay.
So you don't want to get fooled by that. But then we try to gauge the magnitude of the reaction from no envenomation to mild, moderate, severe.
Is the reaction the only way to determine how much venom may be in the system?
Negative.
Okay.
So there are blood tests
Okay.
that can be very helpful and tell us a little more about. Now, there isn't a blood test like the rattlesnake blood test, but one of the things these toxins do is they affect your coagulation system, and so your coagulation system can go kind of haywire if you're envenomated. So we have a way of testing that.
Okay.
And then there's a part of your blood called platelets, and we have a way of testing those. And so there are some things we can look for that are actually pretty reliable clues.
And does that then informs your decision on perhaps whether to use antivenom at all, or whether to use how much?
Yes. Yes.
Let's tell our viewers a little bit about. We've all heard of antivenom. How does that work? How does it offset the poison in the system, the toxins?
Well, the antivenom is called Crofab, or antivenom. And it comes in vials, and what it is, it's produced in sheep. And so sheep are inoculated with rattlesnake venom, and they produce antibodies, and somebody somewhere harvests the antibodies and puts them in little vials, and that's what antivenom is. So it's sheep antibodies that attack the toxins in the bite and the venom.
That's interesting. Sheep will produce antibodies for these toxins, but our bodies won't?
No, our bodies do.
They
but
do, okay.
It's just...
Of course, at that moment, we don't have enough of them.
Right. It takes a while.
Yeah.
Right. So that's called Crofab, and so there are protocols for Crofab that really work well, and so you'll look at a bite, and you'll decide whether clinically you'll decide whether it's envenomated or not. If you start to see bruising, that's a good sign. If you have pain and swelling, that's a pretty reliable sign. And then if you have any of these blood tests. So you're trying to decide envenomated or not, dry bite or not. And then if it's envenomated, we typically make a mark, and we say this is the 1 hour mark or the 30-minute mark, so we know where we're starting. Now, if that stays pretty confined and not moving a lot, that's thought of as mild envenomation, and we don't treat that as a rule.
Okay.
But if it starts moving up the hand, or up the leg. Then we will jump in and use CroFab. CroFab is used typically 4 to 6 vials per dose. So we'll take 4 to 6 vials of that sheep antibody, we'll mix it in with some salt water, and that's what we give the patient. But then we come back an hour later and measure again, and we go, it's still moving, we need to use 4 more. And an hour later, and still moving, we need to use 4 more.
That's intravenously. That's
Correct.
done. Okay,
Yeah,
and then
correct.
do you actually do it? If it's a hand bite, do you actually do it here in the arm? If it's a leg bite, do you actually do the intravenous? Do you put the venom near the bite, or do you put it somewhere just in the system,
just a
anywhere in the
normal
system?
IV.
Okay.
Normal
okay.
IV.
Right. Okay.
Right. So we and our ER docs are particularly good at this. Mark Twain. I mentioned earlier. I sat down and met with the CroFab people. They wanted to meet the doctors at Mark Twain because we use so much of it. and the guy from CroFab, he said, you know, you're one of the top 10 hospitals west of the Mississippi, or west of the Rocky Mountains. You're one of the top 10 hospitals west of the Rocky Mountains for CroFab.
That's incredible.
I said, wait a minute.
We have 46,000 people in our county.
And he was serious. He said, UC Irvine is higher than you, and Portland Health Sciences Universities, and he had a list. And some of them were these little small places. I think Mendocino might have been one. Or Humboldt, one of the two.
Okay.
But Mark Twain was on the map, man.
Our community needs to do a little bit of learning about how to engage with rattlesnakes.
Well, let's talk about that.
Yeah.
Right? Let's talk about that. So, I would say a significant percentage, 30% of the bites I saw when I was doing this work were in people that were intoxicated.
Oh my goodness.
Not a small number. It was a big number. And that creates a problem because if somebody's intoxicated, it's much more difficult to interpret their symptoms. You know, are they overreacting, or are they totally asleep? Can they actually remember what happened? Are they making it up? You know, and so it's a challenging patient to manage. But, you know, a couple guys out at, where was it, Maloney's, in the park at Maloney's, they found a snake, and so they got sticks, you know, and they're playing with it, and one guy claimed, you know, I can get it all the way on the stick, let's take a picture. They got bit. And so they come into the ER, you know, and they're not sober. And you know, the first thing you really want to do is say, okay, tell me the story. I've got to hear the story. You know, there was another guy who had been drinking up in the upcountry, and so I said, well, what exactly happened? He snake bite on his hand. He said, well, I went to the front door because I heard something kind of weird, and I look out there, there's a rattlesnake right on the path to the front door. I said, oh, okay. And I said, so what happened? He says, well, I didn't want it in the front yard, and I knew you could pick him up from behind the head and move him, so I picked him up from behind the head to get him out of the front yard. I said, what happened after that? He said, he bit me. I said, yeah, that's what happens, right?
Oh, yeah, okay, that's good.
You know, probably not fussy. You know, snakes, rattlesnakes in particular, are pretty shy. They don't, you know, there are these creepy movies where they attack you and chase you and all that. That doesn't happen.
Yeah.
They don't do that. I mean, rattlesnakes don't want anything to do with you. They're very shy. They're kind of loners for the most part. They live these lonely lives. I don't feel sorry for them or anything.
Sure.
Right.
Yeah.
But, you know, they'll go away. I mean, if you're, you know, they're rattling on the sidewalk or whatever, they'll go away. I mean, they don't like to be around us. But people fuss with them and, you know, do dumb things with them.
All right, so step number 1 is leave them alone.
Don't fuss with the
away.
rattlesnake,
Yeah.
right? Yeah.
You know, I do have a question about, we hear that, okay, the baby rattlers are the most dangerous because they'll inject the most venom. They don't know how to lay off, right? And they don't have rattles, so you won't hear them. And so all of a sudden you're on them and you're bit. Is there any truth, one, to are baby rattlers more dangerous in that they'll inject more venom?
No.
And two, obviously, do you see more bites from babies because people don't hear them? So those are a couple wives' tales I'd like to know. Okay.
No, I think those are wives' tales.
Okay.
The one thing I do know about the baby rattlesnakes is they can't control their venom as well as the adults. So an adult can decide whether to envenomate or not, and so that's where these dry bites come from. Is I don't think this is worth wasting venom on. I'll try it on something else.
Mm-hmm.
But the babies don't have that control. Baby rattlesnake bites are much more likely to be envenomated.
Okay.
Because they don't have that control and they don't have that experience. But the venom is no different than the adults, and the bite frequency I don't think is much different at all.
Okay. Okay, and then since they're babies, although it'll be envenomated, will it be less venom? Or is it just quite the scale that even the adult will go from 0 to 100%, so there's really no
It's
basis
kind of all the
for
same.
Okay.
Yeah, it's really kind of all the same.
Yeah. Well, okay, so we've got 2 minutes left. If you were going to let people know, all right, you've been bitten, what are the things you got to do, or what are a couple items you wanted to touch on today that maybe we hadn't caught yet that we could cover in just the last couple minutes?
Well, one is I think it really is important to be evaluated.
Okay.
I think toughing it out at home is a bad idea.
Okay.
And I'm sure some of you have done that. Get a bite, hang out at home, fall asleep, sober up, whatever. But I think being evaluated is a good idea. Crofab really works.
Okay.
And these bites can be very disabling, Cory. For example, one of my patients was a truck driver, and he reached over a log or something in the yard and got bit. And so his middle finger swelled up. He was in the hospital. It got huge. It was a moderate envenomation. We stopped it with the Crofab, but he was unable to use that finger after that. I mean, when it was all said and done, most of the meat fell off, and it really became really scarred. And so long story short, he doesn't drive a truck anymore because he can't drive the truck. These are the big rigs,
sure,
and he can't control the big rig without really the full use of his hand. So these can be really disabling, and they shouldn't be underestimated. So you should get help. The Mark Twain Hospital does a great job at this, and the main thing is, don't mess with the snakes. Just let them go.
And those are doctor's orders, aren't they?
Do not mess with the snakes.
There you go. Well, we've run out of time, Dr. Smart. We always could spend more time. So thank you again for a fantastic episode and great information.
I enjoyed it.
Thank you to our viewers for watching Dr. Smart's The Doctor Is In.